Welcome to another edition of Path to Prevention. My name is Teresa Cooey, and I'm the Quality Improvement Nurse at Grace Health. Today's video focuses on navigating breast and cervical cancer screenings. At Grace Health, we partner with patients to support their health and focus on prevention. We also work with trusted organizations to share reliable information and helpful resources. The following video was prepared in partnership with the American Cancer Society and features Zara Kassan, their Associate Director of Community Partnerships, who will walk us through these important screening tests.
Taking care of your health can feel overwhelming, especially when it comes to breast and cervical cancer screenings. There's so much information out there, and sometimes just knowing where to start could be the biggest challenge. But here's the good news. Screening saves lives. And today, I'll be breaking down why they matter, what the latest American Cancer Society recommendations are, and where you can find the support, because you don't have to navigate this alone. Hi, my name is Zara Kassan. I'm the Associate Director of Community Partnerships at the American Cancer Society. Mammograms can detect early breast cancer when it's smaller, more treatable, and before symptoms appear. According to the American Cancer Society, early detection through mammography significantly reduces breast cancer-related deaths. When cancer is found early, your options are greater. Treatment is often less aggressive, and outcomes are much better. And cervical cancer screening is one of the biggest public health success stories we have. Rates of cervical cancer have dropped by more than half in the recent decades, largely because screening catches abnormal changes long before they become life-threatening. These tests are simple, and they can genuinely save lives. Now, it's completely normal to feel nervous, whether it's the fear of pain, the fear of getting results, or the fear rooted in past experiences with health systems. Many people wonder if mammograms will hurt or if cervical tests will feel uncomfortable or invasive. But remember, these procedures are quick, performed by trained professionals, and you can always ask questions, set boundaries, or request expert support. And there's more progress to share. The new ACS cervical cancer screening guidelines include self-collection options, which now allows some people to collect their own vaginal sample for HPV testing. This gives added privacy control and comfort while still getting high-quality screening results. Now let's walk through the latest American Cancer Society recommendations for people at average risk for breast cancer. Between the ages of 40 to 44, you may choose to start yearly mammograms. Between the ages of 45 to 54, mammograms every year. Ages 55 and older, switch to every 2 years or continue yearly if you prefer. And continue screenings as long as you're in good health and expected to live 10 more years. And one more important note. ACS does not recommend clinical breast exams for people at average risk. For cervical cancer, ACS guidelines provide clear evidence-based direction. Start screening at age 25, preferred method, a primary HPV test every 5 years through the age of 65. If HPV testing isn't available, co-testing every 5 years or a pap test alone every 3 years. And yes, self-collected HPV samples are now an optional and acceptable screening option. After the age of 65, you can stop screening if you've had a history of consistently negative and up-to-date results, including negative HPV-based tests at age 1665. The American Cancer Society offers patient navigation programs, educational materials, screening reminders, and tools to help reduce barriers like transportation, insurance concerns, or challenges with follow-up care. We also share research updates and emerging science, like information on guidance on the self-collection. ACS has also introduced its new ACS Cancer Risk 360, an online assessment that helps better identify and address safety-related needs, such as risk-related needs. We also have our ACS Cares, an app that provides compassionate, people-centered support for individuals and families. Additional ACS resources include our Hope Pledge, the communities offering free lodging during treatment, the National Cancer Information Center with 24/7 live support at 1-800-227-2345, our Road to Recovery program providing volunteer transportation to treatment, and our Reach to Recovery, which connects patients with trained peer mentors. For more information and details on other support programs, be sure to visit us at cancer.org to explore the full range of ACS resources available. Screenings aren't just medical tests, they're acts of self-care. They're ways of honoring your health, your future, and the people you love. The more informed you are, the more confident and empowered you'll feel when making decisions about your health. With clear guidelines and ACS support, you don't have to face this alone. Talk to your provider, ask questions, share your concerns, and make your screening plan today. Your health matters, and we're here to help every step of the way. Thank you.